Good evening, everybody, and happy Monday to you all. I am so excited to see you guys, to hear from you guys. I am just happy to be here. I am your host, Audrey Langston, and welcome to my regular guests. Welcome to all my new guests. Hey, Bridget. Hey, holla back, everybody. Hey Lisa, I've got a great show for you guys tonight, a great show. And you know how I always ask, how's everybody doing? I mean that when I ask it, but I really mean it tonight because this show tonight has a lot to do with how you're doing. I want to talk to you guys about your mental well-being. I want to talk to you about stress. And we're going to talk about anxiety, right? So before we get into that, hey, Mickey, I want you guys to share this page. Please, this is not just about my transplant recipients, my people waiting on transplants. This is about everybody. Anxiety and depression affects everyone, us all. Now, it does bother us, it seems like a lot more oftentimes because of our medications. However, that's why I want you to share this page. Hit the like button, please do that, because we never know by sharing who else's life we may touch in this particular moment. Everybody's not good, as we know, about talking about these things. So I want to bring that to the forefront tonight. So do you guys know that I have read before and was kind of reading recently that the nation's suicide rate has reached historic highs even prior to COVID-19. The pandemic, yes, has intensified that, but it's at its highest level right now, okay? And I mentioned suicide because oftentimes, if we don't address our anxiety and depression, it can get out of hand. And the devil is busy, y'all. He is busy. So we've got to get hold of our emotions, all right? So based on today's economics, based on the things we have going on with racial disparities, all the violence, social pressure, and that's just to name a few, and then our own personal relationship problems, all of those alone have heightened the risk for suicide. I know many people who have committed suicide in my career. It's too many, I lost count. And it's very sad. And so many families are left behind damaged after that. So the health officials are even very concerned about this. And this is why, as I said, that we are going to talk about this tonight. So without further ado, I'm going to tell you a little bit about my guest tonight. Her name is Dr. AZAM ARSHADI. She has a doctorate in education and a PhD in psychology. She is what's called a psychotherapist. Now, there is a difference between psychotherapy, a psychiatrist, and a psychologist. That's a lot of psych, but there's a big difference. Psychiatrists tend to deal more with mental health focus, and they can write scripts. Psychologists, they interview you, they assess your situation, they write scripts. Dr. Arshardi, a psychotherapist, you know why I love them so much? Because they really get to the core of what's wrong with you. It's not about medicating you. They're going to talk to you. They're going to figure out a strategy, develop a plan to help you. So this is what she does. And she deals with mental health. She's a mental health counselor of over 30 years. So this woman knows her stuff. She is good. I met her originally through LifeLink. She's worked with diverse populations in various settings, and for the past 11 years, she has been on staff at my favorite hospital, Tampa General. Okay, so she's providing mental health care to so many people every day, and she specializes also with kidney, liver, and heart transplant recipients. Yes, y'all. So would you guys give a warm welcome to my guest, Dr. AZAM Arshadi, and a shout out to my boy, Jerry Brown, my producer. Yeah. Dr. Arshardi, hello.
Oh, hello. It's my pleasure to be here.
Thank you for being here. I am so excited. I've already shared with the audience a little bit about your background, and I'm really excited for us to get right into this. And I want to start by asking you if you would share with everyone what is, I kind of gave the basic definition of what you do as a psychotherapist, but I'd like for you to tell them what a day in psychotherapy is like for you and what is your basic therapeutic approach.
Sure. First of all, I'm glad to be here. It's my pleasure, and I hope everyone is doing well. I'm a psychotherapist, and as a psychotherapist, I evaluate patients, and if there is any diagnosis, I will diagnose them, what kind of problems they have, and I will formulate a treatment plan for them based on their diagnosis, the problems, the concerns that they have. And we'll talk about the goals that we're going to set and the action plans. And my therapeutic approaches, I use different ones, but it depends on the problems that patients have, but most of the time is cognitive behavior therapy because it will apply to most cases and most problems. But also I use solution-focused therapy, I use family therapy, and sometimes I use hypnotherapy, but that's very rare right now. I use relaxation techniques that actually we use for hypnotherapy also, like breathing exercises, guided imagery, visualization for relaxation. That's part of hypnotherapy. So it depends on the problems of the patient that I will change my approaches. Sometimes I use three different techniques for the same session if I see it will be appropriate for the patient.
Okay. And so was I correct, doctor, in my statement with regard to saying that as a psychotherapist, you definitely do not deal in prescriptives?
That's correct. That's very correct. And only psychiatrists do that. Even psychologists, in some states, just a few states in US, they can prescribe, but not all states. Psychologists in Florida are not able to prescribe medications either.
Okay. Okay.
Right.
Yeah. And in relation to this period of time we're living in now with so very much going on this year, especially in relation to COVID-19
Right.
deaths, which we know has brought so much sadness and devastation to us all. I think all of us, or most of us at this point, know someone or unfortunately lost someone to COVID-19, or someone, praise the Lord, that may have gotten through it. What is this classified as in relation to those emotions that you deal with, that people deal with around this time? Would you consider that more circumstantial, or like a more basic type of depression?
Well, a lot of time, a situation like this pandemic will bring a lot of anxiety and fear. Fear is an emotion caused by perceived or definite danger or threat. And so, with COVID, a lot of people will feel that a danger is coming, whether it's perceived by them or it's definite, like they have been confronted COVID, or they have COVID now, or they believe that, or they will have it. So they become fearful, and which is closely related to the emotion of anxiety. And anxiety actually is the anticipation of a threat that is fear. Like anxiety right now, it's anticipation, oh, I will get COVID, what I'm going to do, what will happen if my family does, and it causes fear for them, which the fear then causes anxiety. And fear and also anxiety cause physiological changes and behavioral changes. Physiological changes include accelerated heart rate, chest pain, cold chills, excessive sweating, headaches, muscle pain, shaking, trembling, shortness of breath, sometimes a sleep disturbance, and upset stomach. A lot of time they develop pain that there is no reason for it. And behaviorally, the changes include fleeing, hiding, freezing from perceived traumatic events. And fear response, of course, leads to confrontation with or escape from the threat, also known as fight or flight response. And research suggests that individual fears are not only because of their nature, but also their environment and culture can influence the response that they have. Like with the COVID, in this case, reaction of family members, friends, neighbors, media, all of those play a big role in how people perceive or like feel about COVID, and that influences their fear and anxiety. So, and it's very important for really parents and older people to be mindful of that. If they get panicky in front of their children, and they don't know what to do, and they get very anxious, and because they get panicky, therefore they are not able to protect themselves, they are not able to follow social distancing. So, and children will learn from that. They become fearful, they get anxiety. But if they stay calm, but be vigilant and do whatever they need to do to protect themselves, to protect their families, and the kids, younger people will learn from them. So it's very important for the family to know what they are doing to influence how their children react to it.
Right. So, doctor, would you say, if say a person comes to you to see you, excuse me, in relation to them having, anxiety and stress, and maybe you should elaborate on those two even a little bit, because one person may think they're dealing with just a little bit of stress, and it could be actually some anxiety issues or vice versa. So that's like a part of that question. But also, what is it that you look for in seeing that person, how do you analyze and figure out, okay, this person, how intense what this person is going through, to know if you'll be able to help them, or if you'll have to forward them, you might have to bump it up a notch to a psychiatrist or a psychologist.
Right. Stress, of course, is the feeling of emotional or physical tension that can come from any event or thoughts, whether they are real or perceived. And for many people, the uncertainty of what might happen or how bad things might get is anxiety producing. So anxiety is a normal reaction to a stress, causing a feeling of apprehension and fear, characterized by physical symptoms such as palpitation, sweating, and tense feeling. So a lot of time people will have that for situations, the stressors that they have, it comes and goes. But if anxiety persists and these symptoms are more intense and it exists for like about 6 months, then they are diagnosed with anxiety disorder. And that's when I will send them to a psychiatrist. But when it is like situational, I try to help them to develop better coping skills, teach them relaxation techniques. If there is any stress that they can take care of the stress, they resolve it. I help them problem solving to take care of their problems, so the anxiety will go away. So it's not they are not diagnosed with anxiety disorder. It's just mostly a stress related and situational.
Okay. And so, doctor, I know you deal, because I know my recipients want to know this, because one thing I will say, as you know, and or if you remember, we had a brief conversation before, and I was telling you that I'm a kidney transplant recipient, coming up on 16 years in March of next year, and I'm so grateful to God for that. Yeah, and I can truly say I've never had any major problems. However, I will say this. I know a lot of issues that come forth in the transplant community are based on our immunosuppressants. One being our little, I call it the one that saves us, but it's a little beast, the Prograf. And I know sometimes I will just feel anxious out of nowhere, it'll just happen. You know what I mean? And I really always intensely read up and studied on that, but I finally managed to kind of get myself in a place where, I know how to kind of do a little exercises to kind of calm me down. I know it's different for everybody, but what type of emotional differences do you see in your kidney and liver and heart recipients? What type of things do they tend to deal with regard to that?
Well, as far as side effects of medications and other medications other than Prograf and transplant medication, there are some patients take other medications that also exacerbate the side effects of transplant medication. So if first of all, they need to let their doctors and pharmacists know if there is any other medication that they could take, that it will have less interaction, or completely change the medication. But sometimes I know with transplant medication, there is no other medication, and they have to follow it. They have to take the same kind of medication. So I usually tell the patients and families, first of all, the patients should remember that they get irritated easily. Their tolerance level is less than before. And also family members need to know that if this person gets irritated quickly and is impatient, the tolerance level is not high, is not because of them. It's just a side effect of medication. And the patients need to know to prepare themselves when they wake up in the morning. Say, well, I might be easily irritated, I might have like anger outbursts, but I need to remember to control myself. It's not my family's problem. I shouldn't take it on them. So I need to control myself. And also, I teach them relaxation techniques. When you are more relaxed, it can help. And if you try to keep your mind busy with some hobbies, listen to music, for those who are religious, if you do prayers, read your holy book, all of those could help.
Yes. Yes, indeed. Please, guys. Yes. Hi, Lisa. She said, Lisa Baxter said, Dr. Shardy, you're helping us to know your stuff.
Oh, thank you.
And all those who have questions, please, for Dr. Arshardi, please throw them in the chat box. I'll be keeping an eye out for you for them so I can ask the doctor. So, Doctor, I read up on something I was reading about what's called emotional intelligence. Can you share? I thought it was pretty interesting. I didn't read a whole lot about it yet, but is there anything that you can share about that?
Sure. Emotional intelligence actually is a better predictor of success in people than it is regular intelligence. Emotional intelligence, mostly some people would call it social intelligence, is the interaction between other people. It's how you treat others. Is if you are empathetic, and if you are empathizing with other people, if you have good listening skills, if you have a shoulder for others to cry on, if you have two good ears for others to listen to, or for them to talk to you. So it's just good social skills, I would say, that they call it emotional intelligence. And research has shown actually people who are stronger in emotional intelligence are a lot more successful socially, financially, than people who have more IQ, regular intelligence, but as far as their social skill is less.
And I was in what I read, I was reading also that they tend to be a lot people that are calmer. Their anxiety tends to not, like, some shoot right up, because of those, some of them are gifts, but those skills, that anyone can develop with it's about state of mind more so than anything I would. And so I know that many also, doctor, in the world of transplantation and just in the times that we're living in, are dealing with a lot of sleeplessness, sleep problems, insomnia. I sometimes deal with that myself very often. But can you talk to us a little bit about sleep hygiene and how to elicit better sleep patterns?
Sure, good. Yeah, good sleep habits, sometimes referred to as a sleep hygiene, can help you get a good night's sleep. And we all need to have adequate sleep. It depends on the person. Some people may require only 6 hours, some people 9 hours, but in average about 7 to 8 hours of sleep in order for us to be able to function well during the day. People who don't have good sleep at night, during the day, they become impatient, they get irritable, and they have low energy. If they have low energy, they don't have motivation, so they are not productive during the day. So it's very important to have adequate sleep. So what you can do, first of all, I know nowadays a lot of time people will use their cell phone. They take it to their bedroom, their bed, and go to different social websites. And whether it's reading the news or like reading other people's business, what they are doing, their friends, their family. So either they get upset or they get excited, and then that prevents you from becoming sleepy. So the first thing would be, remove any kind of electronic from your bedroom.
Mm-hmm.
Then you need to be consistent. Go to bed at the same time each night and get up at the same time in the morning, so your body will get into a habit of it. Your body will get conditioned to it.
Mm-hmm.
So you need to make sure your bedroom is quiet, dark, relaxing, and at a comfortable temperature. That's very important. Some research shows that if it's in a cooler side, actually it's better for sleep. People will be able to sleep better than if it's warm and hot, the temperature. So, and then if you get some exercise during the day, being physically active, then you can have a better sleep at night. Avoid large meals, and everyone knows about caffeine. Caffeine can affect, and they say that if you are sensitive to caffeine, do not have caffeine after 3 or 4 p.m. And another thing is alcohol definitely is very disturbing. A lot of people don't know that. And I hear a lot, the patients will say, or people that I know say, well, I drink a glass of wine to go to sleep, or I'll just have one drink to go to sleep. It can promote a sleep. It can make you sleepy, go to sleep, but you will not have quality sleep. That's the problem, because you will wake up sooner. And even if you don't wake up, the quality of sleep will not be good. You won't have the restorative effect of sleep that you could have without alcohol.
Mm. Yeah.
Yeah.
And so I know I've even, I believe I was also once told that there are even trigger foods that can be disruptive to your sleep. I think I was told even that one of them was pastas, spicy foods, in other words. And so in relation to what you said, not eating past a certain time, I would think would be critical in case you've ate some of these insomniatic trigger foods.
Right.
I mean, I don't know if that's correct in what I'm saying, but.
Well, and it depends on, like, a lot of people, they are raised to have like a spicy food, like in some cultures. So they get used to it from childhood. They will respond to it better than if someone hasn't had any spicy food, and so now eat something spicy, definitely that will disturb sleep. And some food, for example, they say tomatoes affect your sleep, and heavy meal that will affect. And and the research shows it's the best time of eating. It's around like 6 or between 5 to 7 p.m., not later, if you want to have good sleep. But if you are hungry, like if you can have like some cereal, some light snack, that could help you.
Okay. Mm-hmm. And what's sufficient, would you say? Okay, so let me grab this. Michelle Colbert says, any advice for sleep patterns for those those who work, she works midnights, the midnight shift. Getting sleep is a lot more difficult when the sun is shining in your face.
That's true. Yeah. Well, quiet environment, definitely. And then again, going to bed the same time, getting up the same time. Unfortunately, people who work at night, a lot of time, not only themselves, but other people in their family expect them to do something, run errands some days, going to doctors or going places. So they do not have good sleeping time, a sleeping habit, that they go to bed at the same time, wake up at the same time. Maybe they need to like talk to other family members, and also for themselves. Do not do some things, for example, during this period of time. If you make doctor's appointment and you have to go somewhere, not from 8 to 2. That's an example, but people need to know what would work best for them. That's the most important. And also be quiet, because a lot of noise is around during the daytime. So if there is, if you live in a noisy place, maybe getting one of those machines that you can play the machine that helps you to relax and for you to go to sleep, but you won't hear any outside noise.
Yeah. Okay, Debbie. She's made tomato soup for homemade tomato soup for dinner, which I love.
Yeah.
So she said no sleep for her tonight. But
Yeah.
Bridget had also mentioned that she takes melatonin, and sometimes that doesn't help. I know for me, Bridget, melatonin, it's not that it didn't help me sleep a little better, but for me, it gave me nightmares, and I'm not a nightmare girl. I don't have nightmares, and I woke up with an awful headache every time I took it.
Right.
So what do you think about melatonin, doctor?
Well, melatonin, our brain actually makes melatonin, and that's why that we go to sleep. But melatonin helps some people to go to sleep, but as far as like keeping them asleep, it won't
Yes.
work that well.
Yeah.
So, but like promoting sleep, it will help a lot of people. And it depends on like the dosage. Some people, if they have a higher dosage, it bothers them more. And some people, a lower dosage doesn't work. And some people, it doesn't work at all. Like for you, you will have nightmares. So you need to like change the dosages to see which one of those will work. And if none of them work, then no.
Exactly. That's what it was. I bought the lowest dosage, and it can't go lower. So it's just not for me. And that's okay. It's good to know, but
That's right.
I've also read, doctor, that as we get older, our body tends to need less sleep. And do you agree with that statement? And what is a sufficient amount of would you say of sleep per night, or will that vary from person to person, male to versus female?
Well, they say that and research shows people who are older, because physically they are not active, they require less sleep, like 6 hours of sleep. It's okay for them. But some older people sleep more. But people who are more active physically and they are younger require more sleep. So for their body to restore. So again, it depends on like how busy you have been during the day. And some people, if they take naps during the day, if for example you require 7 hours of sleep but you will sleep 2 hours during the day, then at night you won't be able to sleep 7 hours, you will sleep 5 hours.
And Debbie Ismer asked about your thoughts on Ambien after, I think she said age 70.
Well, Ambien works for some people, but does not work for some other people. Some other people have had bad reaction side effects. And so just talk to your doctor.
Right.
If you have any reaction or side effects, just let the doctor know.
Lisa Baxter, I missed melatonin for 4 years and didn't know if I could have it with the transplant. I don't know, Lisa. I agree. I think you should always talk to the nephrologist. I was never told it was a problem, so I'm not sure if that's exactly what you meant to say, but obviously it's always best to ask the doctor, especially as a recipient, what you can and cannot take. So I do want to go back to a question, Doc, about anxiety that I felt was kind of important to ask. Do you find that based on age, loneliness and gender play a significant factor with anxiety?
Well, I would say situations play a significant factor, and also women have more anxiety than men do. Right. And, there are some older people that they have less anxiety than younger people. So it depends on their situation, definitely. If someone has more stressors, in their life. They will develop more anxiety. If someone has a comfortable life, it's less anxiety. But if we are not talking about like diagnosis of anxiety, because diagnosis of anxiety sometimes it could be genetic too. So, and sometimes also it could be learned behavior. Like if parents are highly anxious and they get panicky with the smallest stress coming in their life, then children will learn from them.
Yeah.
So it could be genetic plus environmental learned behavior.
Learned behavior. I would
Right.
definitely agree with that. Now, tell me, do most insurance companies, to your knowledge, accept pay for psychotherapy?
Oh yes, all of them. All
Hmm.
of them pay for it.
They do. That's good
They
to
do.
know. That's good to
Right.
know.
Yeah.
And do
Because
you
it's a
feel?
mental.
Go. I'm sorry. Go ahead.
Um, because they need to have like some kind of diagnosis, the patients, to receive psychotherapy, and diagnosis would be like either mental health disorder or a stress or physical problems. So they will pay for it.
Oh, that's good to know because
Right.
it would see, I feel that to me, it's the best first line
Right.
of defense before, trying to see what's really going on. And that's what you do before it's forwarded to the possibility of a psychiatrist or
Right.
psychologist.
Right.
Would you agree with that?
Oh, definitely. And let me tell you this. I'm glad you brought up the psychiatrist because I hear a lot of complaints from my patients when they see their psychiatrist. They say, "Oh, they don't spend time with me to talk about my problems." And psychiatrists are not doing therapy; they just manage medications.
That's what.
And so there is no expectations of
Mhm.
psychiatrists to spend a lot of time to go over life stories and challenges and the stressors, because the first time they will spend like 30 minutes to get a history of you and prescribe medication, and after that it will be like 10 minutes. They spend 10 minutes with you.
Yep.
So if the medication is working or not, if it's working, continue with the same. If it's not working, change the dosage or change medication. So, and if there is any need for psychotherapy, they will refer outside to another provider for psychotherapy.
Yeah. Yeah.
So
I
please,
could.
if you go to a psychiatrist, don't expect that they're going to spend a lot of time with you, so you will get discouraged. No, it's just
Right.
they will spend just little
Right.
time with you. Yeah.
Right, right. Jared, could you throw that question back up there from Michelle Colbert, please? And anyone else who may have had one. The older I get, the more I feel like I need a nap at midday. Should I give in to that feeling or fight it? If so, that I can sleep better at night.
Mm-hmm. Well, that would be the best thing, because if you sleep during the day, it will disturb your sleep at night. And a lot of time when people get bored during the day, they get sleepy. So if you keep yourself busy, be productive, call others, like get a hobby, keep yourself busy, then you won't get as sleepy as if you get bored and you are alone, don't have anything to do.
Mm. Now, here's a good question that I'm going to piggyback on from Michelle Colbert. Michelle, that's my best. She's a police officer too, but
Mhm.
midnights, yuck. I was on midnight. I hated it. I did it for a minute. I couldn't do it. God bless the people who can and have no problem with it. However, what I was going to ask is, okay, Bridget, I'm going to get to that in 1 second, Jared. Do you see in any of your patients that the hours, the shifts that they work can even have an effect on their on stress and anxiety with them? Just maybe, you know what I mean?
Right? Those who work at nighttime.
I knew it.
If they have family members, like children at home, they have a lot of responsibilities. They don't get adequate sleep. Even if they sleep during the day, it's not solid sleep, it's not quality sleep.
Mm-hmm.
So, after a while, actually, research has shown that, after a while, they get depressed and they
Mm-hmm.
can be diagnosed actually with depression.
Mm-hmm. Mm-hmm.
Right.
Mm-hmm. And it makes sense because
Right.
I just don't think, I've always thought it wasn't natural, you know what I
Mhm.
mean, per
Right.
se, to be up all night, and especially depending on the career that you're in,
Yeah.
how aggressive it is. That's an aggressive career. Before we get to Kent's, Jared, could you put that question from Bridget back up there for the doctor, from Bridget? Is golden milk, if you're familiar with that, doctor, okay to drink to help you sleep? I've made some of that before too. Are you familiar with golden milk?
No, golden milk. No, I don't. I'm sorry. Tell me about
Okay.
it. What is it?
Oh, I don't remember it had, okay, I could tell you some of the things in it. Turmeric. It was comforting things that will enhance
Mhm.
sleep. And I have the
Right.
recipe actually in my cabinet.
Mhm.
But I only tried it twice, and it
Mhm.
was a bit helpful for me.
Right.
It was nothing wrong with me taking it, Bridget. My
Mhm.
doctor, I ran it past him. He said it was totally fine. It's natural ingredients, and I don't
Mhm.
drink regular milk, so it was almond milk.
Right.
Yeah, with a
Okay.
few other things, but I'm sure it's
Right.
fine. Jared,
Mhm.
could you put that other question up there, please? You two have
Could
some
you
more. Oh, I'm sorry.
could you
Uh,
read it, please? Because I can't
Sure,
read
absolutely,
it in
doctor.
this.
It's from Kent. Hi, Kent. And he said, I've had my brother's kidney now for 33 years. Oh my God,
Oh,
congratulations.
wow, that's great.
Wow, that's what
Yeah.
I was going for, Kent.
Yeah.
And I've been on prednisone and Sandamune. I am 70 years old now, and I've had thoughts of having to deal with a loss of kidney function and possibly losing the kidney as I age. Do you have any recommendations?
Well, as long as you do whatever the doctors ask you to do,
Mm-hmm.
and as long as you eat right, don't use alcohol, don't use any substances, you'll do well. These are the things that you are in control of. There are some
Right,
things that we are in control of, and we do
right.
what we are in control of. But there are some things that is beyond our control, and uh, we can't do anything about it. So do whatever is under your control, and again, take your medications, and no alcohol, no drugs, because they will affect kidney. So you'll do well.
Awesome. Okay, so this is the last question we'll take, and we'll get to the next phase. From Lisa, how do you help children not to, thank you, Lisa, this is a good question, not to be stressed out in this pandemic, in this time of, pandemic with the COVID-19 fears?
I'm sure. Well, you need to talk to them based on their age appropriateness. If children are younger, they don't understand abstract. So you need to talk to them in a way that will understand. And also, you need to keep your calm. In children who are older, then you talk to them about what's going on. But again, keep your calm and tell them again exactly that these are the things that we have control over, and we'll do our best to protect ourselves. Practice social distancing, wear your mask, and when you are with your friends, you need to be mindful, teach them what to do if they are not practicing. So it's based on age appropriateness, but
Mhm.
we always need to keep calm, stay calm, so they can learn.
Awesome. Great. Great.
Thank
So,
you.
Dr. Ashardi, if someone wanted to get in touch with you regarding, your services, how would they go about doing
Right.
that?
Well,
I'm sorry, this is for the state of Florida
right,
audience. I'm not saying
right,
she doesn't. Do you take virtual calls, by
right.
the way?
Well, my full-time job is at Tampa General Hospital,
Right.
and Um, I only see patients over there who are patients of Tampa General. And if any of you are patients of Tampa General, you can call my assistant. Her name is Michelle. And her phone number is 813-844-5688.
Awesome. Also,
Right.
at the bottom of the screen, I have running a few numbers for the National Helpline for Mental Well-Being, as well as National Suicide Prevention. Now, prayerfully, no one will need these, especially the suicide line. However, if your condition, if you are really stressing and having some anxiety and depression to the point where you feel out of control, I would implore you to call. These services are 24 hours a day. There's nothing to be ashamed about. I mean, we would totally want you to get the help that you need right away. Correct, doctor?
Oh, yeah. Yeah. That was very well said. A lot of time, prevention is a lot easier than treatment. So you need to prevent problems from happening, from coming. And even with the stress, if you prepare yourself for a stress to come, then you will respond to it a lot better. We are not talking about COVID. Well, COVID, again, what you can do is what you have control over, protecting yourself.
Right.
But with other stressors, if you prepare yourself for a stress to come, then you'll respond to it a lot more appropriately, and it will be less challenging.
Right. Prevention.
Right.
That's right. That's what it's all about. Well, doctor, we're going to close out with this special thing that you're going to do for us that I just love, that I've done before. And it is a breathing exercise. I know, Debbie, we love you. I know Debbie Ismer. Her brother stopped dialysis. He made a decision to stop his dialysis after 4 years, and he just recently passed away. So,
I'm sorry.
our heart goes out to you for that, Debbie. And as of next month, November 17th, Debbie will be 10 years post kidney transplant. She is my partner over at Tampa General. We would go see all the transplant patients until, unfortunately, we went into COVID.
Right.
Yeah, she's with LifeLink as well. She's a sweetheart. So I want everybody to really make your area for the next 10 minutes quiet. We're closing out with this. We're going to do a wonderful de-stressing breathing exercise that Dr. Arshardi is going to lead us through. So I just want you to make sure that you can either, doctor, I'll let you tell them sitting or lying down, or I'll let you go on and take it from here.
All right, thank you. Well, I'm going to integrate deep breathing exercises, progressive muscle relaxation, and visualization or imagery of peaceful places. And these are evidence-based techniques that reduce anxiety and help to relax. So wherever you are at, move into a comfortable position. Uncross your legs and arms and gently close your eyes. Take a deep breath on the count of 4. Hold and exhale on the count of 4. Take another deep breath and relax. Relax all the muscles in your body from the top of your head to the tips of your toes. Relax. Tune into your body and notice how it feels. Take a deep breath and focus on your breathing. As you focus on your breathing, remove any stress from your thoughts, mind, and body. Let that stress go and relax. Take a deep breath slowly through your nose, if you can, on the count of 3 or 4, all the way down into your stomach. Hold on the count of 3 and 4 and feel your stomach expanding. Breathe out deeply on the count of 4. Continue deep breathing exercise 10 to 12 times. Breathe in peace. Breathe in tranquility. Breathe out all the stress from your thoughts, mind, and body. Breathe in joy and tranquility. Breathe out all the toxins and all the stress from your body, thoughts, and mind. Breathe in a healing energy. Breathe out all the toxin and stress. Focus on your breathing for a few moments and relax even deeper. As you are relaxing more, feel your toes and your feet becoming relaxed. The relaxation extends to your legs. Your legs are heavy and warm. Feel them relax. Relaxation extends to your thighs and hips. Your thighs and hips are warm and relaxed. Now feel all the muscles in your abdomen and lower back becoming warm and relaxed. Feel all those muscles relax and warm. The relaxation extends to your chest, upper back, and your shoulders. Your breathing is comfortable. Your shoulders are limp and heavy. They are so relaxed. Now the relaxation extends to your upper arms, lower arms, and your hands. Your arms and hands are warm and heavy. They are so relaxed. Now you feel all the muscles in your neck and your face are warm and relaxed. You feel your jaw dropping because those muscles are becoming so relaxed. As you are relaxing more, imagine you are in a very peaceful place all by yourself. There is no one else there. That place can be any place you choose. Perhaps it's a beach, your grandparents' backyard, a park, or a place you visited. That place can be your very own place of peace and relaxation that you can go to anytime you wish. Your relaxation place is so peaceful and tranquil. The temperature is just right for you. Look around you in your relaxing place. Look at different colors, different textures. Focus on the details of what you see. Your relaxing place is, if your relaxing place is the beach, imagine you're walking on the soft sand. The temperature is just right for you. A nice breeze is coming. Your breathing is so refreshing. The water is so clear. The water is so clear. The waves are rhythmic and calm. You see lots of fish, different colors, different sizes, but they are so beautiful. Perhaps you hear exotic birds singing and flying all over tropical trees. They are so colorful. It is so peaceful in your very own place of peace and relaxation. Now look around you and focus on your breathing again and feel refreshed. Try to think of one thing that brought a smile to your face. Think about one thing you can do to bring joy and happiness to your day again. Perhaps it could be calling an old friend, remembering a happy time with someone you cared about, spending some time with your loved ones, or simply watching a comedy. Now feel relaxed and energized. You are becoming stronger and more awake. You are awake and strong. Now I will count to 3. When I say 3, take another deep breath and gently open your eyes. 1, 2, 3. Gently open your eyes when you can. And thank you for listening.
Oh my God. That was so awesome.
Oh, thank you.
And I just have to share with you and everyone, when you said to think of something that makes you happy, or that brings you joy, when as you were coming to the last part, the closing of that, and I thought about, you said playing in your grandparents' backyard. Oh my God, that did it for me.
Really?
That was such fond memories that I have, playing in the yard with my brothers, and our friends would come over. That was just so awesome.
How nice. Oh,
yeah.
Great.
And I'm sure everyone, I know that was a benefit to everyone. Kay, just chime in and let us know. But also, this is a technique, doctor, that everyone can continue to use at home, correct? I know we won't have the melodious voice coaching.
Right. Yeah, that's actually what my purpose was, just for people to learn, because it's very easy, as you just realized and you saw. It's very easy to do. You can do that like for 5 minutes, 10 minutes, 30 minutes, as much as you need.
Awesome.
So you can focus on the breathing alone, or you can focus on progressive muscle relaxation alone, or you can focus on visualization of peaceful places. So all of those are evidence-based. Research has shown that could help you with anxiety, especially the physiological effect that we have.
Awesome. Awesome.
Thank you.
Such an awesome way to bring an ending to this. I could have listened to you and met through meditation another 30 minutes.
Yes. So, thank you.
I'm sure
thank
everyone
you.
else could have. Dr. Arshadi, I want to thank you so very much for being
you're
here
welcome.
tonight.
Thank you for inviting.
Yes, you bless so many people, and my friend Steve Belcher, who is our, I call him the big guy. He's talking about you making an appearance on his show, which is Urban Media. We're all a part of the same show. So I will pass on email information regarding that. And Dawn said I break them up to use with clients. My short sessions. Oh, okay. I see what she's saying. That's good, Don.
That's
Thank
good.
you
Yeah.
for sharing that. Yeah, that's a great idea. Well, anyway, guys, we're going to say goodbye to Dr. AZAM ARSHADI. And please, those that are Floridians and that would like to speak with her or have a session with her, the information is out there. You can always, if you did not get a chance to write it down, you can definitely inbox me and I'll make sure that that gets to you. Thank you so much, Doctor. I really appreciate you, and have a wonderful, wonderful night.
Well, thank you for inviting me. You all have a wonderful night, and thank you for listening, everyone.
Absolutely.
Thank you.
God bless you.
Thank you. God bless you. Thank you.
Thank you. Wow, guys, did you all have a good time? I had a great time. It was a great show. I do pray that it was informative and helpful to everyone. And again, I would implore you to hit the share button for this show, because again, we don't know who this could bless. And I really am pleading with you, for those who may be dealing with things that they feel are out of control, to please, please, please reach out to a friend, a family member, someone you can trust. I know how important that is when you are putting your personal, business out there. Unfortunately, society has always looked at anxiety and depression and things like that as a weakness. That's a lie. It is a lie. The devil is a liar. Okay. We deal with these things for different reasons, all sorts of reasons. Okay. Especially in the year 2020. So please do not hesitate to reach out. And as usual, I just want to leave you with my scripture verse for each show. And it's always a scripture that's near and dear to my heart and very befitting for this show, which is Matthew 6:34. Do not worry about tomorrow, for it will worry all for itself. Why? Because each and every day is going to bring enough trouble of its own. That's it in a nutshell. Jesus is telling us, don't worry about tomorrow. It's nothing we can do about it. Let's focus on getting there in a good state of mind. All right. Thank you guys so much for joining me. Again, I'm Audrey Bella Langston. This is Sisters Against Kidney Disease. Jesus loves you, and so do I. Ain't nothing you can do about it. Have a great night. Bye-bye.